your question. Not too much, but at least you've got a question. And you have 1 minute to read the question. Right, so if you have read and understood, considering the clinical examination station, kindly
Yeah.
please begin.
Hello.
Yes,
Yeah, good morning. I'm Dr. Ahmed, one of the surgical doctors. Nice to meet you. Can I confirm your name and the age, please?
I'm Smith, 55 years old.
Nice to meet you, Ms. Smith. Today I have been asked to examine you as you have a chest pain post-operative.
Okay.
Do you have any pain right now?
Yes, I have chest pain.
You looks ill or something like this. You have a shortness of breath.
Yes, too much.
So I can give you some oxygen.
You'll check yourself. Yes, yes, please.
Yeah,
Take your
I will give you this oxygen as I know from your case that you are now post-operative day 8, so you looks ill. So I need to examine you as a patient of critically ill surgical patient. This includes some examination of look, feel, move for your general condition and for your chest and for some pulse and doing some reviewing of the chart. This is okay?
Okay.
So I will start by this patient as you talk to me, so your airway is patent. I will check the breathing by checking the central cyanosis.
Okay.
I will check if the patient has a ballon. I will put the pulse oximeter.
Okay.
And I will checking the respiratory rate.
What more would you do
For this
for this particular patient? Yes, please.
Yeah, I will check the trachea if it's central or not.
Okay. And
I will feel the chest expansion.
okay.
I will try
How
to.
would you do that?
I will put my hand, my two hands together down the nipple at the level of the nipple, all
Yes.
above the three level.
Okay. And
To see and ask the patient to take the inspiration. So I want to see my hand expanding away from each other.
yes. What else would you do? Please imagine and keep telling me.
Yeah, I will. This is for breathing. I will go for the circulation. I need to assess the blood pressure for the patient. I will check the pulse rate and rhythm. And I need to review the patient chart. I will also see if the patient has cannulas, or I will insert 2 wide bore cannulas and take blood for close matching, and maybe consider to give the patient blood. I will auscultate the chest of the patient to see if there is crackles or heart sounds.
Yes.
And I will go later. I will, if the patient, according to the chart, if the patient has a hypotension, and I will give the patient fluid, crystalloid, 1 liter of crystalloid. I will see, and the patient is alert. Is alert.
Okay, and
I will check.
what have you checked in D?
D, the alert for the patient,
Okay.
the
Patient
response.
was Glasgow Coma Scale and okay,
Yeah,
and E?
E exposure. I will do exposure.
Yes. And what would you check for exposure? Because you have to rule out
for this patient, I will check the
calf,
chest.
calf muscles. Yes.
I will
What?
check and also the calf muscle if he has pain at the lower calf, because this is
Yes.
post-operative day 8 full light hip replacement. If the patient has a pain a pain at the cuff, I will not squeeze the cuff. Maybe this patient has DVT, and I will spread it. So I
Yes.
just know if the patient has a pain at the cuff or no.
Yes.
I will examine also.
What would you see in the patient chart, drug chart, medicine chart?
For
What
the
would you-
patient, for the
for the
patient
patient?
chart,
Yes.
I will see the vital signs for the patient,
And?
blood pressure, pulse, and I will also need to check the ECG,
Yes, and
the fluids for the patient intake. Maybe I will check also the medicine for this patient.
yes, medicine, heparin.
Yeah, if this patient
if patient
take
is getting it or not.
anticoagulant, post-operative or not.
Yes, and you'll check also if patient is wearing TED stocking or not.
Yeah, patient will taking or not.
What else? You've already told me blood pressure and
Blood,
ECG. Would you
yeah, I will check.
also ask for ABGs?
Yeah, I will check also for the ABG for the patient, if the patient maybe has a metabolic
Okay,
acidosis.
right. So can you please summarize your examination now?
So my examination will include according to the Ccrisp, airway. The airway, as a patient is talking with me, so the airway is patent.
Yes.
Then I will go for breathing. I will check if the patient has a cyanosis, pulse, pulse oximeter. Pulse oximeter. I will check the chest by check the respiratory rate, tracheal, central.
How would you, I'm sorry, I have to interrupt you. When you put the oxygen mask on the patient,
Yeah.
What was the hemodynamics of the patient? Was the patient stable? How much was the saturation level that you noticed?
The patient saturation will be maybe around 90 to 95.
Okay. What does this tells you? That patient was stable hemodynamically or needs management? How would you
Maybe
interpret that? Yes.
the patient has maybe has a hypoxia.
Okay. How much oxygen you gave to the patient?
15 liter via non-replaceable mask.
Okay, very good. Yes. What else? Did you squeeze the leg?
No, I didn't squeeze the leg because this patient has a high risk for post-operative DVT. So maybe.
So what is your provisional and differential diagnosis for this patient?
As this patient post-operative post-right hip replacement, this patient has a high risk for develop DVT and pulmonary embolism secondary to.
What investigations would you ask for to rule out your provisional and differential diagnosis?
I will ask for ultrasound, for Doppler ultrasound for leg veins, and I will
Okay.
ask for CT pulmonary angio for chest to rule the pulmonary embolism. Maybe
Yes, and?
some blood test also.
Yes.
Like
D-dimer or?
D-dimer, like D-dimer, yes.
Yes, okay. If you suspect patient to be suffering from pulmonary embolism, what would you see on ECG? Yes, the interpretation or the results that you can expect to see on ECG.
I will maybe I saw the pattern for the pulmonary embolism S1 Q3
Yeah.
changes in
S1 Q3
in S1.
pattern. Yes.
Yeah.
With deep S wave. in lead 1 and Q wave in D3 and
This
inverted T wave and right axis deviation
right axis deviation.
and right ventricular strain pattern, T wave
Yeah.
with T wave inversion, you'll see. Okay. Just suppose a patient is suffering from pulmonary embolism. What is the management or alternative treatment you can offer to the patient?
I will support the patient, the hemodynamic of the patient. If the patient is hemodynamic unstable, has a high potential, I will give him fluids. If this patient has anemia, I will collect this. I will start the low molecular weight heparin for this patient.
Okay, then please keep on telling me all the treatment.
Low molecular weight heparin for this patient. I will follow by
Just suppose this patient is stable. Okay, there
Stable.
is suspicion of pulmonary embolism, but patient is stable because
Yes.
95. You said oxygen saturation would be 95. Now
Yes.
tell me what would be the management? How
Low,
would you? Yes,
low molecular weight heparin.
and followed by you have to give the advice.
Followed
How
by
long you'll give? How long you'll give long that heparin, and then it will be followed by warfarin. When would
followed
you
by
ask for warfarin, and how long would you give subcutaneous heparin?
I will if the patient start I will start by low molecular weight heparin, then I will accompany by warfarin if the patient can take oral medicine.
Okay, as soon as and also involving the medical team in it for the follow-up. Okay,
Yes.
very good. Just pose last question, bell is gone. If you're scrubbed and a nurse comes and tells you about this patient, what would you do then?
I will try to if I'm scrubbed in the surgery and there is someone and the surgery can going without me, I will go to the to check the patient and I will give him the management.
You're scrubbed. You cannot go yourself. What would you do?
I will ask the patient. I will ask the nurse to give a cold blue.
Code blue, crash
Cold
call.
blue. Yes.
Yes,
Yeah.
immediately. Very good. Very good. That was the answer I wanted. Okay, good. Thank you.
Thank you.
Now, yes.